relax and learn medical, where 432 Hz music may help you to retain information faster. In today's video, we're focusing on the incredible structure of the bones of the legs. Whether you're a student, healthcare professional, or lifelong learner, our goal is to help you absorb valuable knowledge in a calming, engaging way. The human legs are marvels of strength, balance, and design, supporting the entire body, enabling movement with some of the largest bones in the body. In this section, you'll find over 140 essential terms and meanings. Let's explore how each bone plays a crucial role in movement, weight-bearing, and overall function, all while enjoying a peaceful learning experience designed to relax your mind and enhance your memory. Let's start by exploring the medical terminology and definitions related to the bones in the legs. Major bones of the leg: lower limb. Femur, thigh bone, the longest and strongest bone in the body. Patella, kneecap, protects the knee joint. Tibia, shin bone, larger weight-bearing bone of the lower leg. Fibula, thin bone on the outer side of the lower leg, non-weight-bearing. Tarsals, group of 7 ankle bones. Calcaneus, heel bone, largest tarsal bone. Talus, connects the leg to the foot, part of the ankle joint. Navicular, boat-shaped bone in the midfoot. Cuboid, cube-shaped tarsal on the lateral side of the foot. Medial cuneiform, one of 3 wedge-shaped bones of the midfoot. Intermediate cuneiform, middle wedge-shaped bone in the foot. Lateral cuneiform, outermost wedge-shaped bone. Metatarsals, 5 long bones in the midfoot. Phalanges, bones of the toes. Proximal phalanges, first toe bones attached to metatarsals. Middle phalanges, middle bones in toes, absent in big toe. Distal phalanges, end bones of the toes. Bone landmarks, attachment points and features. Greater trochanter, prominent lateral projection on the femur. Lesser trochanter, smaller projection below the femoral neck. Femoral head, rounded top of femur that fits in the hip socket. Femoral neck, connects femoral head to shaft. Linea aspera, ridge on the back of the femur. Medial condyle, femur, inner knee surface of femur. Lateral condyle, femur, outer knee surface of femur. Medial malleolus, bony prominence on the inner ankle, tibia. Lateral malleolus, outer ankle bump, fibula. Tibial tuberosity, bump on the tibia where patellar ligament attaches. Intercondylar eminence, projection between the tibial condyles. Shaft of femur, long middle part of the femur. Patellar surface, anterior surface of the femur for patella articulation. Popliteal surface, posterior surface of femur near the knee. Fibular head, top end of the fibula. Anterior crest of tibia, sharp ridge of the tibia shin. Joints and articulations: hip joint, ball and socket joint connecting femur to pelvis. Knee joint, hinge joint between femur, patella, and tibia. Ankle joint, talocrural joint, hinge joint between tibia, fibula, and talus. Subtalar joint, between talus and calcaneus, allows inversion, eversion. Tarso-metatarsal joints, connect tarsals to metatarsals. Metatarsophalangeal joints, joints between metatarsals and toes. Interphalangeal joints, joints between toe bones. Movements and direction: flexion, bending the knee or hip. Extension, straightening the knee or hip. Abduction, moving limb away from body's midline. Adduction, moving limb toward body's midline. Internal rotation, rotating leg inward. External rotation, rotating leg outward. Dorsiflexion, lifting the foot upward. Plantar flexion, pointing the foot downward. Inversion, turning sole inward. Eversion, turning sole outward. Clinical terms and conditions: femoral fracture, break in the femur bone. Tibial plateau fracture, break in the top of the tibia. Shin splints, pain along the tibia. Osgood-Schlatter disease, inflammation at the tibial tuberosity. Stress fracture, small crack due to overuse. Osteoarthritis, joint wear and tear. Bursitis, inflammation of joint bursae. ACL tear, tear in the anterior cruciate ligament of the knee. MCL injury, medial collateral ligament strain or tear. Patellofemoral syndrome, pain around kneecap. Achilles tendinitis, inflammation of the Achilles tendon. Ankle sprain, ligament injury in the ankle. Clubfoot, Talipes equinovarus. Congenital foot deformity. Flatfoot, pes planus. Collapsed foot arch. Bunion, hallux valgus, deformity of big toe joint. Acetabulum, hip socket. Articulation, where 2 bones meet. Avulsion fracture, small piece of bone pulled off by tendon ligament. Calcification, hardening due to calcium buildup. Cancellous bone, spongy bone found at the ends of long bones. Diaphysis, shaft of a long bone. Dislocation, bone out of joint. Epiphysis, end of a long bone. Femoroacetabular impingement, hip joint abnormality. Fracture, broken bone, green stick fracture, partial fracture often in children. Growth plate, epiphyseal plate, area where bone grows in length. Hallux, big toe, impacted fracture, bones driven into each other. Ischial tuberosity, sit bone of the pelvis connects to hamstrings. Joint capsule, membrane enclosing a joint. Lateral, side of the body or bone. Ligament, connects bone to bone. Long bone, bone longer than it is wide, e.g. femur. Medial, toward the midline. Meniscus, cartilage in the knee. Metaphysis, area between diaphysis and epiphysis. Osteoblast, bone-forming cell. Osteoclast, bone-resorbing cell. Osteocyte, mature bone cell. Osteomyelitis, bone infection. Osteoporosis, weak brittle bones. Periosteum, membrane-covering bone. Physis, another term for growth plate. Popliteal fossa, hollow behind the knee, posterior toward the back. Radiograph, X-ray image of bones. Reduction, realignment of fractured bone. Rotational deformity, twisting of bones. Sesamoid bone, bone within a tendon like the patella. Spongy bone, inner porous bone tissue. Stress reaction, early stage of bone overuse. Synovial fluid, lubricates joints. Tendon, connects muscle to bone. Trabeculae, mesh-like bone inside spongy bone. Torsion, twisting force on a bone. Valgus, bone angled outward, e.g. knock knee. Varus, bone angled inward, e.g. bow leg. Weight bearing, bones that support body weight. You've just explored over 140 essential terms and meanings related to the bones of the legs, each one a step toward mastering anatomy in a peaceful and effective way. Whether you're studying for exams or simply passionate about how the body works, with each term you've reviewed, you've strengthened your medical knowledge in a calm and mindful state. Stay with us for more beautiful learning experiences that elevate both your understanding and your inner peace.